Forbes Africa and Philips hosted the latest edition of the Future of Health Summit at a Blue Tie Brunch in Sandton. And as the symbolic blue tie suggests, November is Men's Month, and the event was focused on men and their health. What are the health issues men have to watch out for? And how can one ensure that one has a healthy and long life? The keynote speaker was former Protea cricketer Dave Callahan, who had the audience enthralled with his experience with testicular cancer.
On Monday morning, after I got 50 odd on the weekend, took 4 or 5 wickets, top of the world. World Cup side's going to be announced in December to go to the World Cup in March, in February, in 92. Everything is going as planned. Went in on Monday morning, and when I woke up from my operation, there my father was standing there, my wife was standing there, the minister was standing there. And I realized something had gone wrong, or something was wrong. And they explained to me that they had removed a tumor. And they'd send it away for testing, but it looked fairly aggressive, that's what I was told. So at that stage, even mentioning the name tumor didn't really make any sort of real impression to me at that stage, because cancer in those days was like a disease that really nobody wanted to talk about. So later on, we had some more discussions, and when the doctor said to me, I said to him, why have you sent it? When you say aggressive, he said, no, we sent it away because it could be cancerous. It was like every single bit of blood from my head had gone down to my feet. It just suddenly I realized that there was a possibility that I had cancer. Now, obviously 6 months of treatment, no hair, playing cricket, or setting myself goals. And I remember one little simple goal that I set myself over that time. You know, we listen to people, we stay positive. I had a little word that I've always adopted in my life. It's called attack, a simple word, attack. The first letter was attitude, and the last word for me was knowledge. I used it when I was playing because I was a fairly attacking type of cricketer. I like to hit the ball, like to take wickets. So I took the attitude, and I always said, a successful person never has a bad attitude. And I knew that I had to use that attitude, and right at the end was the K for knowledge. I had to know what was going on. So I adopted this, and I used this word in my fight against cancer. And fortunately, because of my sporting achievements in that, there were a number of things that I learned from the likes of the Donny Gabbers and the Kepler Wessels and that type of hard work, dedication. And I applied all these type of things over that 6 months that I had my treatment. But I was positive there was one goal that I set at the end of that season, that I just wanted to get onto the cricket field for just one game. That was my goal. The comeback game I came back was the one that I made 75-80 at St George's Park in that Benson Hedges night game, when I walked out onto the field. And there were 17,000 people there with a standing ovation. I remember standing at the crease looking down the wicket, and Clive Eckstein was the bowler, the left-arm spinner for Transvaal. We were playing against Transvaal. I remember the blur, I couldn't see a word, couldn't see him for the tears in my eyes because of the reception that I had received at St George's.
Dave Callahan recently lost 2 of his best friends to cancer and warned about the importance of early detection and diagnosis to prevent death.
I know for a fact that when they had a pain, or they were feeling uncomfortable, because there's not always pain. When they were feeling uncomfortable or not well, they certainly didn't go to the doctor, because men are too bravado to go, yes, no, we're going to go and have ourselves looked at, or go and have ourselves checked out. Okay, no, it's fine, it'll go away. Well, my message to everyone is early detection is key, and the only way that you're going to be found out early is by either going to the doctor and knowing what you look for. Because just a simple ball that hit me in my groin area made me go to the doctor. Other than that, I would have never been to the doctor, and I would have let it try and go away, because I had no idea. So please, when you do feel uncomfortable, make sure that you go and have yourself looked at.
Forbes Africa editor Chris Bishop hosted the panel discussion and tackled the matter of the typically male fear of going to the doctor.
I think where we stand currently, really, the services that we have are not biased towards men's health per se. just general services that are being provided. And of course, there are barriers. Most of our service providers are female, and you find that men find it difficult to disclose or to want to get further information in terms of what could be wrong with them, or discuss their sexual health or any fears that they have around their issues. And of course, I think communication becomes a barrier. There's intergenerational differences as well. I remember as a nurse in the clinic, young men would come, look at me and wouldn't want to tell me what was wrong with them, or they'll use language that I did not understand, like they will say 6'9", I wouldn't know what they were talking about. But going forward, because I think in the past 2 years, even though I'm responsible for nursing, I was given the responsibility to coordinate men's health campaigns in 2015 and 2016, I think. And we saw that there was a lot of interest. And then when we walk about, like last week, I found that there was a group of men in one of the clinics and they were dealing with their issues. But I think from the department side, what I would say is that we'll be looking at finding champions within our male nurse cohorts who would want to champion and be the entry level. Because like I said, the community in the clinics in the hospital is mainly females because they are aware and they find it easy, but with men it's a problem.
So, Mr. Bernstein, just where do you think men's health is at the moment?
Well, I think it's a very interesting time. Certainly, I've been a urologist for 20 years plus, and what's interesting, I agree with what Joanna said, is historically men took the sort of ostrich approach, stick your head in the sand and hope the problem goes away. They weren't proactive about taking an interest in their own health. And certainly, what I've noticed, particularly probably in the last decade, that the media have taken this on board and been a champion for men's health. And I think that's been very good. It has been driven, for rightly or wrongly, a lot by healthcare companies. But they've invested in it for their own good, but also in the interest of the community. And I think the other thing that's had a big impact has been social media. There's no doubt that social media has had a massive impact, particularly with the younger generation, the millennials, people that are more in touch with new social media much more often in raising awareness. And I think the world is changing in the way that we promote men's health, and all for the good.
Ria?
I think in today, where we are today, if we think in terms of pre-diabetes, type 2 diabetes, cardiovascular disease, cancer, if you look at the number one recommendation from the American Heart Association, American Institute for Cancer Research, European Association for the Study of Diabetes, they recommend is abdominal obesity, is watch your waistline. And according to Americans, we're looking at 102 centimeters, according to the Europeans, 94 centimeters. Because these abdominal fat cells, they're not innocent. They basically release substances we call adipokines, cytokines, that increase blood pressure, that increase the thickness of your blood. It release inflammatory markers, and we all know that cardiovascular disease is there's inflammation involved. And last but not the least, it also makes your cells resistant to insulin. So I think that is key to men's health, and then we can talk later on in terms of nutrition, what we need to do.
Richard, what's your views of the issues here we should be looking at?
Men are biologically different from women, and men are more susceptible, for example, to myocardial infarction, heart attacks. So the male gender is a risk factor for myocardial infarction. That is why, in fact, if you look in communities, you would find a lot of elderly women without men. The husbands, they die earlier. We also have aggression, the testosterone that God has endowed to us men. It's also a very dangerous hormone because it makes us take risk where otherwise the women would not. And I think, Carlos, you mentioned something very important. We've got the macho factor. We don't complain. It's taken that if you've got a bit of chest pain, if you've got a little bit of discomfort, society does not has socialized men into not complaining. When a man cries, it's frowned upon, and you expected to be stronger. And really, it's a socialization thing that we need to change. We should encourage men to cry. It's not a sissy thing. We should encourage men to. I must say there's one exception though that I found in Europe and even here, that Greek men complaining. I don't know, Jose, you're not Greek, you're yeah, they really do complain. So that is the one exception that I can think globally. But in general, especially African men, particularly Zulu men, you wouldn't complain. They come. I work at Baragwana in addition to be with the Art Foundation. We see a lot of women. Women are the biggest users of our healthcare facilities. For one, they don't, they're usually homebound, so they've got the time, to go to see the doctor in the clinic. So I think we need to work, with government to really try and have that mindset, so that our men folks can live as longer as our women folk.
How do we overcome this idea of going for a medical, it's a big risk and it's a danger, to men of a certain age?
Well, I think you're right. Men have got a fear. I think there are preconceived ideas, and it's almost the fear of the unknown. And you have to break down those barriers. It's not easy. A lot of the time it's driven by the wives and the women, and the messages sent out in women's magazines. Women talk at the bowls club and the bridge club and wherever they socialise, and so they often prompt it. And you see often when you see couples, when you consult, they come for the first time, the man coming in pale, anxious. The wife will often tell you he's been anxious for 2 weeks before, not sleeping well.
Sometimes 2 years before my garage.
And they, the common theme is they say, well, come on, tell your story, and then you sort of eke it out of the patient, and then the wife is prodding him along saying, tell him this, tell him that, you forgot about this, you forgot about that. It's a common theme we see. And it's really just educating the public to say, it's in your best interest. And I think the important thing is then to realise often economically active men, young families or children, that they're supporting, and it's devastating if they don't, or if they, early diagnosis of cancer or sudden death from cardiac disease is devastating to families. And I think that's the way to approach it. It's almost tug at the male's emotional heartstrings to say, you know what, you've got a responsibility to your loved one.
We'll be back after a short break with the impact of a healthy lifestyle and technological advances in medical diagnosis and treatment. In the second part of this highlight special, Chris Bishop starts by addressing the matter of prevention, of a healthy lifestyle for individuals rather than reacting to health crises.
Joanna, I come back to you as government as well. I mean, isn't all of this a massive cost to this province alone, your province alone here, and the fact that people have time off work, they're in hospital, they're maybe disabled because of their lifestyle, etc. What do you say?
Yeah, it is a massive cost, especially, if your workforce is not well. So that's why it's in our interest that the men are well looked after, because they engage in risky lifestyle, like Prof was saying about smoking, alcoholism, accidents. You find that majority of your casualties are men, so it does affect your workforce. I think the wake-up call is that, like I was saying, we're beginning to focus more on men's issues within health, as government, because it's something that I'll see men's magazine and glance over it and see that they were showing, six packs and not really other things that are more important. But I think as government, it's in our interest, because the cost of the expenditure, as the CEO was talking about, of healthcare has gone up even in government, given the fact that we've got documented and undocumented individuals in the province. And then as government, we have a responsibility to look after all of them, including those that are not documented. So the interest is that we have to focus more on prevention and see how best can media be used, which we haven't explored, so that they can know the basics that Prof was talking about, and maybe find a way that they find information easy for them to use, so that they can, interact with the information and begin to look after themselves more as government, where we need to make sure that I talked about confidentiality, having the right attitude so that the environment is for them to come to us to say, can we talk about the following problems? Can I go for this test? Do I need, which test do I need, for example? Currently, I can say the barriers are many, and like government, we haven't really focused, but it's something that we're beginning to look at. But I think the media, the partnerships with private sector also would be beneficial, because then private sector always have something different that the government is thinking.
I mean, you're in the more sort of preventative line of medicine. I mean, how do you approach it? Persuading people. I mean, it's in the papers, it's on the radio, full on, and people still don't do it.
That's quite a good question. I think, nutrition is quite complex, and for people to start eating healthier is not always so easy, because they're part of families, and it is the individual, but it's also actually the whole family that need to eat better. Women are the people who buy food, who cook, who's responsible for the food in the house, in terms of whether it's healthy or not healthy. And although the media are out there, it is difficult in a sense. You need to acquire the knowledge, and then you need to practice it. We all know what to do, we all know what to eat, but what I found, people find it difficult to practice it and then to do it probably good enough to get a positive outcome, whether it is to lose weight, whether it is to get my cholesterol down, whether it is to control my blood sugar levels better. So what I would recommend is that use professional people to acquire the proper knowledge. As I said, nutrition is complex, and we can talk about that. And then get the practical tools. There's not one diet that fits all, it's all individual. You get the quick diets in the media in terms of what get proposed is whether it's low carb, high fat, low fat. What research tells us, it can be effective in the short term, but it's poor tools for people to really incorporate it as a healthy lifestyle in the long term. So I would say, get the good knowledge, and then you need the practical tools. You literally need a good menu. Healthy eating doesn't dawn on everyone. You need to do planning, and you need to do good shopping. And you need a menu, you need a shopping list, and then it needs to be practiced. So the behavior around food, the attitude toward food need to be practiced, and you need your financial advisor, as you need your doctor, you need your dietitian to help you along.
Okay, Greg, looking a bit to the future now, you mentioned it's a very exciting time in the healthcare business. There's a lot of new innovations coming. What do you think is going to come up in the next year or two that could change all of our lives in this room, in terms of men's health, especially?
I think, again, going back to prostate cancer, in the last 20 years, I think we've been stuck in a bit of a rut in terms of prostate cancer diagnosis. So we've used ultrasound. So if you went to the doctor, you had a PSA test, it was elevated. We had very few ways to be able to say, have you got clinically significant prostate cancer? So most men underwent a biopsy. It was not an image-guided biopsy. We used imaging, ultrasound, but you can't see the bulk of cancers on ultrasound. So we took blinded biopsies. If you think about other solid tumor cancers, breast cancer, colon cancer, lung cancer, there's no other cancer where we just fire a needle in blindly and hope that we're going to hit something. And the problem with that is that we missed a lot of cancers. Up to 25% of cancers were missed. And then downstream, you had about 40 to 50% of patients that had to undergo another biopsy with all its discomfort and risks and so on, because the first biopsy hadn't performed well. Today, we've got image technology like MRI, so we've combined. We've got a cross-sectional imaging technology, multiparametric MRI, so we can use MRI with well-trained radiologists. And one of the big breakthroughs is that we can see the majority of clinically significant cancers. And using new technology now that with Philips and Invivo we're bringing into South Africa, that we're able to then take that information from the imaging and combine it with our real-time ultrasound to guide us to see where the majority of these dangerous cancers were, so that we pick up more of these clinically significant cancers, and we actually pick up less of the low-grade, low-risk cancers that may not be any threat to men, but actually result in a lot of over-treatment of men with prostate cancer. They end up having unnecessary treatment, and with all its inherent side effects and psychological effects. And that can be rolled out to things like robotics. So the exciting thing is that a lot of these technologies, we're able to do real-time imaging now. So we combine, for example, minimal invasive keyhole surgery or robotic surgery, and we incorporate technology. So for example, you may have a kidney cancer, and while we're operating on it, for remove a small tumor, we can combine the information from an MRI or a CT. Real time, we can project that image while we're looking at the kidney and operating on it, and find out where this cancer is, and go and excise that cancer with a negative margin, stop the bleeding, take the patient off the table. So this combination of technologies is, I think, going to be one of the at the forefront of all of medical technology in the next year. And really things like robotics is transforming many aspects. So there are things like exoskeletons. So robotics is now moving into every sphere. There's robotic brain surgery, there's robotic orthopedic surgery, hair transplants. These exoskeletons can allow people that can't walk with neurodegenerative diseases or spinal cord injury to actually get up and walk, when previously they'd been confined to a wheelchair. So technologies that are going to really transform people's lives. And again, the cost, just a word about cost. We always say, well, it's not for us, we can't afford it. And I think if you always get stuck on that point, then you may as well give up the ghost. You really need to fight your corner. There is money in the system. As you said, we've got lots of money to do all sorts of strange things. We're spending billions of actually US dollars in the desert putting up space telescopes to look for black holes. Now, is that really going to afford, we need to fight our corner for healthcare. So there is money available. We just have to use it in the right way. And I think coming back to the professor's point, it's about governance, it's about leadership. And if we can put our resources in the right places, we can use technology to best effect.
Richard, in the field of cardiology, how is technology and innovation changing the way that you treat patients?
The development in cardiology and what we can do today has been driven by technological advances. For example, whereas in the past we would need to open your chest to replace certain valves, now we can do it from the groin. It's called a TAVI, So technology it's very, very important, because in the field of cardiology, as it is in many fields of medicine, you need to be able to define the problem adequately in order to treat it. Today, if you've got myocardial infarction, if you come within a certain time, if you present to hospital shortly after the onset of chest pain, we can immediately open up the blocked coronary and abrogate the infarctions. So we can prevent myocardial loss and save your heart. We're able to go in from your groin using specialized wires and catheters, identify which one of the three coronaries are blocked, and we can fix it. And equally, whereas in the past, if you've got triple vessel disease, if all your three coronaries are blocked, the treatment would be bypass surgery, where we open your chest and you're in hospital for 2 weeks, 3 weeks. Today, with the advent of what we call drug-eluting stents, technology, we're able to fix that from the groin using these specialized stents. I have got this thing to say to my patients. Unfortunately, in this country, if you don't have money, you die. You said so, Carlos. If you really don't have money, you die. If you've got money in South Africa, you've got a little bit of niggling chest pain, you go to Sunny Hill or Mill Park or wherever, we do your angiogram, you've got a blocked artery, you're busy infarcting, we open up the artery, the infarction subside, we lower your cholesterol, we lower your blood pressure, we lower your sugar.
Well, I'm afraid we've run out of time here. Thank you very much to my esteemed panel here, Professor Richard Netonunda, cardiologist, Ria Katsikas, the clinical dietitian, Mr. Greg Bousted, specialist urologist, and Johanna More, the Director of Nursing for Gauteng Province. Thank you very much for taking the time. I'm afraid that's all we've got time for on this discussion, but for me, Chris Bishop, the editor of Forbes Africa magazine, is goodbye.
The audience and speakers then moved on for some spirited networking over a scrumptious and healthy brunch.